Welcome to the JACC Edge podcast. This is your host, Pratik Doshi. I currently serve as the editor-in-chief of JACC Edge, a monthly newsletter where we do a deep dive on a hot topic in cardiology in an innovative and engaging format. Today, we are lucky to be joined by our very talented guest, Dr. Laxmi Mehta. Today, we're going to be looking into burnout and wellness within the cardiovascular community. To briefly introduce Dr. Mehta, she is a non-invasive cardiologist and professor of medicine in the Division of Cardiovascular Medicine at The Ohio State University. She holds the Sarah Ross Soter Endowed Chair in Women's Cardiovascular Health, is the current section director for preventive cardiology and women's cardiovascular health. She's also the associate vice chair of wellness and for the Department of Internal Medicine, as well as the chief of wellbeing and faculty director of the Gabe Health and Wellbeing Program at OSU's Medical Center and College of Medicine. Dr. Mehta, it's such a pleasure to have you here.
Thank you, Dr. Doshi. I'm really excited to be here.
Yeah. If you don't mind, would you be able to give us and our listeners a one-liner about yourself, about who you are and kind of the things that you like to do in your free time?
Yes. Well, you heard from Dr. Doshi that I'm a cardiologist at The Ohio State University, Wexner Medical Center, and my interests in medicine have been around cardiovascular prevention and women's health. But over the last 6-7 years, I've gotten into the space of burnout and well-being and what it means like to be a cardiologist. I'm in a different stage in my career now, or of life, I should say. I've never known a day of being a cardiologist without being a mother. I started cardiology fellowship with being pregnant, about 6 months pregnant. So that's always been a part of the journey and how it wraps into well-being as a woman and how it can impact burnout. But this is the first year that I am an empty nester. And so it's a different type of transition. So finding time for the activities that I like. So I love traveling, love food, love to exercise. So I've been able to shift time to me, which is important when we talk about well-being.
Yeah, absolutely. How is it being an empty nester right now? What do you like to do to kind of occupy that time?
Well, I thought I'd have a lot more time, but it's quick. It's funny how your time quickly fills up. I've been able to dedicate more time to my own well-being, making sure that I'm getting enough time to do exercise and the activities that I like, or watching movies, spending time with my husband. But also I'm taking a new job as chief well-being for the medical center here. So that's also occupied quite a bit of time.
Yeah, and we're really excited to kind of dive into that. To transition into the actual topic for today, the winter season, as I think most of us are aware, is known by attendings, program directors, and trainees as a pretty dark time. It's a time where emotional exhaustion is really high and at least provider satisfaction is relatively low, as well as really, really high work-related stress, high social and family demands, with really cold weather that just seems to sap the joy from the holiday season. So we're dedicating this month to raising awareness about provider burnout and strategies to improve well-being. So Dr. Mehta, to kind of start us off, what is your opinion of the current state of wellness within the cardiovascular community?
Dr. Doshi, that's a great question, and you summarized it well. I don't think we're really in a good state at this time, and for a lot of reasons that are work-related, societal-related, as well as environmental in terms of the weather and things like that. But burnout rates are pretty high, and so in 2021, our ACC data showed the highest rates in cardiology that we've surveyed, and was at about 42%. Of our survey respondents had said that. So that's about 2 in 5 of us cardiovascular professionals that are experiencing burnout, and about 40% are highly stressed, which means that they can tip one way or the other to being burned out or not. And unfortunately, 18% say they're enjoying their work and not stressed, not burnt out, which is, those numbers are just not acceptable. We also see in our data that women tend to experience burnout at higher rates, as well as the mid-career cardiologists are experiencing it at higher rates than even early career or late career. And this can then negatively impact us professionally. And so, those that are burned out just don't feel like happy at work. They don't feel like they're worthwhile at work. They don't feel like they're in control, or that they're able to solve problems as well as they would like. And it then impacts their interactions with their colleagues, with their patients. And burnout and not being happy doesn't just stay within our work, it then overflows into our personal lives and can be difficult. We've also seen that people who are burned out really don't recommend a career in medicine to others. And that's a shame, because we really want to encourage this field to the best and the brightest. But I don't want to sound so dismal, because I don't think that this is just a case in cardiology. This not doing well is a state where we are in medicine as a whole. And so we really are at a time where we need to pivot as a field. And we need to improve the well-being. Interestingly, we had some recent data on mental health conditions in cardiology, and globally, like 1 in 4 of the cardiologists self-reported that they had a mental health condition. Granted, we used a wide terminology for that. So it could be people who had alcohol or substance use disorder, if they had suicidal tendencies, if they were irritable or very anxious types of personalities, or they had major depression. So it's a whole slew of things. But the fact is, 1 in 4 of us is struggling with some sort of mental health condition. And alarmingly, only 1/3 of the people who have a true mental health illness are seeking care. So 2/3 of the people that need care aren't even seeking help, for a variety of reasons. One of the biggest ones is the stigma in medicine of seeking help and how it might impact us professionally. So that's problematic too. So to sum it up, no, the state is not the greatest at this time, but I'm optimistic that, we can hopefully make changes in the future.
Yeah, and I think, in my opinion, when I, as an early trainee, kind of looking at this, it's nice and important to see that there's people like you who are doing research, because if we don't have awareness of how significant the issue is, I feel like it's very hard to develop good models of improvement and good models to then deploy both here and internationally in terms of how do we reduce provider burnout. The question I have with that is, do you feel like there are certain aspects of cardiology that drive burnout a little bit more than maybe other aspects of medicine?
So, that's a great question. And I think that, you know, our data has shown that all types of cardiologists are struggling with it. So I don't, and even our CBT members, I want to put a shout out for them too, and they're struggling. So I don't think there's necessarily an aspect of medicine, of the type of person or the type of role that they're doing is impacting them. I mean, it's from bottom to top and top to bottom, people are experiencing it. They're experiencing that emotional exhaustion, the depersonalization, and the dissatisfaction with their accomplishments in a perceived like very stressful environment. And, I want to pause and say that this didn't happen because of COVID, right?
Mhm.
These issues and what we've reported were even pre-COVID. Certainly the workload worsened after COVID, but a lot of the drivers and stressors that we talk about were pre-COVID. And the only thing that allowed what happened with COVID too for us is that it allowed people to talk about it more and openly and not feel ashamed with these mental health conditions or even saying burnout. And so we're as a field, we're starting to at least acknowledge that it does exist. And so I think our data is showing that, and that's good that people can feel like they're not in isolation alone. But it's also important to recognize that solutions need to be made. And so, yes, their well-being and well-being can manifest in different things. Some of it is the work-related stuff, but it can overflow into our financial obligations. Like many of our trainees are struggling with their student loans and how to pay that off. But digital health is an issue too. So, not just electronic records, but the email burden that people experience top to bottom can impact them. And so and the lack of control, we don't have control as trainees, as simple cardiologists, as CVT care members, we don't have control anymore that we did in the past. And that is also affecting us. But I would even say our leaders don't have control, right? There's environmental aspects that are impacting us. The healthcare industry, the demands put on us, the reimbursements that institutes are facing too, has a trickle down effect. So I don't think anyone is immune to it. Their perspective may be slightly different, and what's impacting or driving them can be different. And so I think that, we all need to acknowledge everyone is burning out, I shouldn't say everyone's burning out, but many people are burning out, but majority of people are stressed, if not. And to acknowledge that, accept it, embrace it, be empathetic towards others, and how to figure out, it's not we versus them. It's like it's our I versus them. It's like we as a group, how can we fix it together? Because sometimes the greatest solutions are when you collaborate and not see the divisive line of what your role is in an organization.
I really love that. I really love that idea of building a we culture within cardiovascular medicine and medicine in general, because it often is our group versus another group, and I think it's important to kind of push back against some of that culture.
Exactly. We
Yeah.
talk about the teams in cardiology, at the ACC, we don't just talk about cardiologists, we talk about the entire cardiovascular team. And so I think we need to recognize that we work together as a team. And I don't just take my dirty work and shift it to the next person, but trying to make sure everyone's working at their top of their license. And it's really shown in healthcare right now with the workforce turnover that there's a shortage of nurses, which now is impacting all of us too, right? So the we is very necessary. Sorry for cutting.
No, absolutely. I agree. It's such an important aspect, and it's so pervasive to kind of section off in that way. And unless we make a conscious effort to build we into our daily interactions, even at the trainee level, the culture won't change. So I really appreciate you, commenting on that. To follow up, a thing you brought up a little bit earlier, how do you believe we should address burnout at different career stages? For example, the way I may engage in wellness or feel burnt out as a medical resident versus what may affect an early career attending or a chief of a department such as yourself are probably different scales and different stressors. So how do we address wellness at these different stages of life or in training?
That's a great question, and it really takes thought. I think one is assessing your local situation. So what is not just the rates of burnout locally, but then asking people with surveys and qualitative interviews on what is driving them, and then you can make a change, right? When we look at how to address it, I like to use like the Stanford model of well-being. And so how do we impact a culture of well-being? And so depending on your career stage, that can be different, right? What is acceptable? Like if things like, when can you take vacation as a resident or trainee, and why are there certain rotations? Or are you allowed to, is all the scut work supposed to be thrown on you? Or if it's non-educational, is it worth it? There's lots of different things in the culture that could be changed. And then if you're like a higher level, it's those, like, what are the demands on our non-working time hours, and what should we, how it should be respected is important. And then the second aspect is process efficiency. So how do you make the workflow better, whether it's in electronic records, or is it rooming patients, or it's throughput in the cath lab, whatever it is. But there is no simple solution that we can just say this works across the country. I think everyone kind of needs to look at what's the hiccup in their area, and what are the things they can remove that are unnecessary, and what are the things that they can add that can make it more efficient. And that's a whole new science that's going to happen in process efficiencies and optimization. And encourage some of the trainees out there to start investigating in that and doing little projects in that area. The third area to consider is the personal resiliency. Like, so how do I get myself enough armor to protect myself? Because there are going to be challenges in medicine, whether we have a perfect environment or not. There are some inherent things that happen, as well as the mental health conditions. And so many organizations already have things in place for that. So you want to, reach out to your local hospital and figure out what's already in place and what can be further added. Many institutes do focus on the personal resilience. It's that piece where it's like, I can fix you, but ignoring of the work environment. So you really want to make sure the first two pieces are also addressed. One thing that in the personal resiliency that has helped a lot and is shown in data is coaching. Has been shown to be beneficial in reducing burnout, and even having peer support groups and what that can look like in your own organization's important. So to sum it up, I think you kind of have to investigate it yourself at your local level in terms of what's impacting the culture of well-being, what's impacting process efficiencies and optimization, and then what's impacting personal resiliency, and address it that way.
Absolutely. I think, at least as a trainee, and I think I hear the same sentiment when I speak to more senior colleagues, where it often feels like a personal burden. And that idea that it's more of a social environmental issue is often not addressed. So I think I agree with you where since COVID, that focus away from just the person to the social environment, the hospital environment, the culture that we work in becomes really, really important. And on that note, I want to bring up an important article you helped write back in May of 2021, which was published in JACC, about harassment and discrimination in the workplace. And it was based on a global survey you and your team conducted. And I was hoping you could tell us a little bit about that and about how that may have affected you, or how we can kind of address some of the issues that you brought up in that article.
Yeah, that data, thank you for bringing it up. We reported like 44% of nearly 6,000 cardiologists globally reported working in a hostile work environment. And we defined hostile working environment as a self-reported discrimination, emotional harassment, or sexual harassment. And so 44% is high, but when we separated it by gender, 68% was in women. And that's really unacceptable. That's more than 2/3 of us are experiencing that at some time in our career in medicine. But it's not negligible in men, it's 37%. So men are not immune either. So culturally, there's an issue. Gender was the most frequent cause of discrimination that people reported, but it's followed by age, because some of our senior colleagues and have experienced ageism, the race and religion, sexual orientation. Those are things that are impacting people's well-being and feeling the harassment and discrimination, whether it's overt or subtle. It's existing, and we really need to change the culture within cardiology and more broadly within medicine. And we have to have a zero tolerance policy for this behavior. It's just entirely not acceptable. And so we need to self-reflect at our own organization levels of creating a safe and inclusive environment and a place where people can report adverse conditions and these discriminations and harassments without the fear of repercussions. And failure to do that and to create that safety is just unacceptable. And so that's at an institutional level that we all need to do. As an organizational level, ACC has included it in their policy statements and have made it clear that, like, when you're accepting speaking roles, that these are, that discrimination and harassment are unacceptable. And we even have our DEI policy as part of our state opening statement for all our committee meetings. So just having it up front in the openness culture that we will not tolerate this. This is inclusivity is an important aspect for us as a professional organization, has also been important. And that's how we can develop allyship amongst us and really reward people, not just have the punitive thing, but reward people so that of having inclusive environments, and really setting that inclusivity and that diversity needs, not just from leadership trickling down, but from the bottom up to and middle across and just everyone. I think we'll have a better workforce, we'll have better care of our patients if we all feel like we're included and that we feel safe in our work environment.
Absolutely. I think it's absolutely it's so important that everyone, regardless of race, gender, ethnicity, feels like they're walking into a place where they're cared for, so then they can care for patients. And I think that's such an important thing. And I before reading your article, I did not realize how prevalent it was globally. And I hope that we can develop initiatives to really work on that and reduce that number. Just because I want to be cognizant of time, wanted to ask you, for individuals who might be listening, who are interested in improving wellness and working on initiatives to mitigate burnout, are there any resources that you could recommend that might be beneficial to them?
So resources wise, I would say, we have some things on acc.org under the well-being tab. The American Medical Association has great resources on the Steps Forward program that has many different modules that people can look at and follow in terms of how to do the business case for well-being, how to address the culture, how to improve process efficiencies. So there's some simple webinars there too that I have found beneficial as well. And then, just staying up to date on the literature, being, on social media, many of us tweet about that. And then creating your own group locally and across the country too of open spaces for discussions of topics like these, because solutions can be local, but also sometimes we can translate it across the country. So I find a lot of help also with other people across the country that help kind of put things together. And so for any of the listeners, if you have ideas, feel free to reach out to me or ACC with thoughts, comments, because we are clinician wellbeing working group. We're always looking for ideas.
Absolutely. And we will link Dr. Mehta's social media, if with her permission, in our show notes at the end of the episode. Dr. Mehta, thank you so much for your time. It's such a pleasure speaking with you, and I look forward to hopefully seeing you at ACC this year.
Thank you.
For our Absolutely no, thank you so much for being with us. For more content about burnout and wellness, as well as other hot topics in cardiology, subscribe to the JACC Edge newsletter. And for our listeners, this is your host, Pratik Doshi, and we hope we catch you next time on the JACC Edge podcast.